Hello and welcome to Module 1, Lecture 1 for CHP 305, Community, Health, Advocacy, and Social Movements. Our objectives for today are analyzing the social and economic factors that make communities vulnerable, listing important social movements in community health, and understanding the link between social movements and health advocacy. So here are your week 1 readings and media, health activism, community health advocacy, Body and Soul, your textbook, United in Anger, our film, which we'll be discussing at the end of the week, and a few videos about advocacy. So what is advocacy? Well, it's defined by the International Council of Nurses as blending science, ethics, and politics. Advocacy is self-initiated, evidence-based, strategic action that health professionals can take to help transform systems and improve the environments and policies which shape their patients' behaviors and choices, and ultimately their health. As defined by Dr. Sana Louie in her 2005 article, community health advocacy entails advocacy by a community around issues related to health. However, that community is defined or formed. So there's also communities of circumstance that she talks about, which may form around a shared issue, an experience, a leader, a locale. If you think about our readings for the week and some of the videos, you'll have examples of these communities of circumstance, issues and exposures and experiences that have formed communities. So, and it was interesting that she cited the McQueen article that we read in CHP 300, your intro class. So, approaches to advocacy, there's grassroots, which is also known as bottom-up advocacy, which is based on the needs identified by the community members themselves. It has a focus of empowerment. Zoller talks about that in the Health Social Movements article quite a bit. It could be a neighborhood, community of ideas. Louie has these 3 categories: communities of ideas, community of memories, or communities of crisis. So it could be, grassroots organizing around those. There's also top-down approaches to advocacy, where experts, it could be a doctor, it could be a government, it could be an international organization, identify health needs of the communities. They also define who the community is and what they call health, or they define the standard of health that they're talking about. So, health social movements, as we saw in the article, it's about changing social norms, policies, medical practices, things like that. So there's, as you know, there's a women's health movement in the 1960s and 70s. You can ask your parents or elder generation about this. Groups and unions for retired persons helped to pass Medicare in 1965. Environmental health activists, by collectively organizing and having a movement around the environment, helped to create the Clean Air Act of 1970, the Clean Water Amendment of the same act in 1972, and the Environmental Protection Agency. The International Baby Food Action Network, I think you have a video by them in your other course, 305, when we're talking about community health interventions. So IBFAN, as they're called, 1979, started with a health social movement against Nestle Corporation and their role in promoting baby formula for mothers who even were capable of breastfeeding. So about that, there's the Physicians for National Health program, which is a really amazing organization. and they do a lot of advocacy about having a national healthcare program, which means we'll get more into single payer health and healthcare and what that means, but basically having affordable healthcare for all. And there's the Center for Science in the Public Interest, which lobbied for a trans fat ban, if you've heard of that, which was banning certain types of fat from our food production system. So no matter the approach, advocacy always requires organizing, that is, preparing the people, the medium, the message, to advocate in a health social movement or in an advocacy campaign. Mobilizing, which is generating action. It sounds like a fancy word, but it's really just getting people together to have a positive change or impact. And then there's needs assessment, which is often it's a more formal process. Sometimes it doesn't have to be. It could be going around door to door of your neighborhood and asking people what they need. In Hurricane Sandy, I remember in New York, people were doing a needs assessment after the fact instead of before, but they were seeing what people needed to recover from the hurricane. So ideally, both experts and the community would be involved in a needs assessment. Consensus or agreement on the identified needs. So if some people say, oh, the community needs that, and the experts say, no, the community needs this. There must be a consensus to have a successful needs assessment. There's study design, which utilizes primary data, which is collected by the community that you're planning to make a program for, or and also the secondary data, which is already published research about this. So your evidence base for which you're saying that you would like to do something or study something or something like that. So good study design is a big part of needs assessment, and a review process where the experts, the community get together and talk about whether this was effective or properly done or appropriately done or just whether it went well. And then planning for disseminating and using findings, because that's one of the most important parts of community work, which is sharing the findings with the community. So levels of advocacy there's many levels. It's hard to make a matrix like this because there's so many ways you can break it down, but I just did it kind of on the international level, which is the biggest level that we have in our kind of superstructure of governments, is something like the United Nations, who, for example, passed the Declaration of Alma-Ata for primary care, prioritizing primary care for underserved populations. And that was definitely a form of advocacy for health promotion and prevention. There's the Indian Health Service, which is an example of a federal level organization, which is there to provide actual health services, but also to advocate for American Indian health needs and problems in their communities. So on the community level, we have many examples in our reading. We have ACT UP, we have the Black Panther Party, we have many groups that have come around to just having arisen from a need to advocate for their own communities. You'll even see that if you travel up to Seattle to the International District, and there's all kinds of East Asian and different types of health groups and organizations and providers which serve certain communities. So an example that I had here was We Act for Environmental Justice for the neighborhood of Harlem in New York City. It's an organization I worked with which did really wonderful work on air quality while I was there, and looking at how the distribution of diesel bus depots, which are highly polluting to the atmosphere from diesel exhaust, and other factors that influence your breathing and respiratory health, such as construction sites and debris and um, just other air polluting um, uh, other forms of air pollution were highly concentrated in neighborhoods like Harlem uh, and areas where lower income residents were living. So We Act did a lot of great work regarding that in that community. And on the individual level, there's many forms of advocacy, as you know. And one example I had was just maybe a medical translator for speakers of languages other than English. The Physicians for National Healthcare, which we mentioned on the prior slide, had a wonderful presentation by medical translators in Seattle's Harborview Hospital, and how they not only serve as literal translators of language, but they're also cultural navigators for people who've come from other countries and need a bridge between a cross-cultural bridge. So they're really wonderful advocates and make sure that people get the healthcare they need and speak up. So these are just some examples, but there's many more of the levels of advocacy. So advocacy strategies, just a little quiz for you. Which level are these advocacy strategies that we are listing here? So there's law and policy. Is that international? Is that federal? Is that community level? Civil demonstrations and protests. Collective bargaining. You've heard of what labor unions do when they need a change or they need leverage for an issue. There's popular and public education, and we'll be exploring that with our media work in this class. There's formation of organizations and groups, which you've seen in your reading, where, again, the need arises and people step forward and say, I need to advocate for my community or for this community or for people that don't have social and political leverage as much as, say, I do or you do. So being advocates for our own community, other communities, contacting representatives of legislative bodies. At what level can we do that? Can individuals do it? Can community-based organizations do it? Can actual state governments talk to federal bodies? I mean, I think this is an all-level kind of strategy. And then there's, I mean, in the case that there's a democracy, sometimes you can explore other governments and it's a different process. It might be harder or easier, but where we are living in the United States, sometimes this is an effective strategy. And then incorporating health literacy into patient appointments. So at what level is that advocacy? Yes, it's definitely individual level because you're taking care of a patient, but how do we make this a policy and say that health education needs to be present in